Hello, my name is Pablo Enrico. I'm a specialist on the S.I.N. Research and Development team.
Let's take a look at the Versalis kit. On the upper left side, we have the indications for conventional implants. The lengths vary from 8.5 millimeters to 18 millimeters, with a dashed line for soft bone and the solid line for more cortical, harder bone. Implant diameters range from 3.5 to 7 millimeters. And the drilling sequence starts with the lance drill. 2.0. We also have the Lindemann, in case the surgeon needs to adjust the angulation of the initial drilling. And from there we follow the sequence up to the chosen implant diameter.
Let's imagine a conventional drilling for a 3.8 millimeters diameter implant in soft bone. We should then follow the dash sequence. We will start with the lance drill. We will move to the 2.0 drill, which is the most important, determining the angulation and depth of this implant. From there, for soft bone, we will go to the 3.5 drill and then to 3.8. And here we finish the sequence for soft bone. Now, if it is hard bone, we will follow the line, where it will be the same thing. Starting with the lance, diameter 2, 3.5, and now, instead of following the same line, we will go down to the hard bone row, which will be 3.8. but using the drill below. From there, we have the entire sequence here, where, if we want to place it subcrestally, we will use the countersink, and we also have the direction indicator specific for the 3.8 diameter. Notice that the tip of the drill has the same shape as the tip of the selected implant. If the cortical bone is very thick, we can also use the countersink. There are two markings here, one for bone level and the other for 2 millimeters below the bone crest. In the center of the kit, we can see the direction indicators. They are separated according to the selected implant diameter, be it 3.5, 3.8, 4.0, 4.3, or 5.0. They have depth markings and a stop to facilitate visualization on the X-ray. It can also be characterized by its two sides. One side is 2 millimeters, and the other has the diameter of the selected implant. In this case, as you can see, 4 millimeters in diameter. So this side can be used for multiple drillings and this side for the final drilling, according to the selected diameter. On the left side of our kit, we have the pickup and installation drivers. For the capture driver, we have the short and the long one. They are to be used with the contra angle. And at the tip, we can see a retention feature so the implant doesn't come loose. So the implant pickup will be performed with these two drivers, the short or the long one. The implant installation will be done with these two drivers, the short and the long one for the torque wrench. We can observe its specific fitting for the torque wrench. In the lower part of our kit, we initially have the direction indicators, starting with 0 degrees, where we can also see the gingival depth indicator, and the angulation indicators, which we have for 17 degrees, 30, and 45. Right below them, we have our drill extender, our 1.2 contra angle driver, our 1.2 hand driver, and our mini abutment driver. We can also see extra slots to add whatever the surgeon deems necessary. On the right side of our kit, we have the drills for long implants. Here the length varies from 20 to 24 millimeters, with available lengths of 20, 22, and 24 millimeters. These are only for soft bone. So we have the Lance drill, the 2.0, the 3.8, the 4.0, and finally the 4.3. On the lower right side, we have a scale, a depth gauge with the actual size and measurements of the drills contained in the Versalis kit. Using a conventional implant drill, we have depths of 8.5, 10, 11.5, 13, 15, and 18 millimeters. At the bottom of our kit, we have a presettable torque wrench, where we can set the torque to be used. And it is a breakaway torque wrench. When it reaches the selected torque, it will break with this movement. We also have a beam torque wrench, where you will insert the implant and measure the torque according to the markings on the beam. And finally, the latest innovation in this kit is the depth gauge, with markings for conventional implants from 8.5 to 18 millimeters, and on the other side for long implants from 20 to 24 millimeters in depth. To disassemble your beam torque wrench for cleaning and lubrication, turn it counterclockwise and remove the 3 parts. These parts must be cleaned and lubricated. To reassemble, just fit the parts together and turn clockwise. Once the torque is reached, it will return to normal operation. The beam torque wrench must undergo periodic maintenance. We will remove the first part by turning it counterclockwise and then lubricate this entire assembly after cleaning. Inside, you can clean it, and it separates into 4 distinct parts. To reassemble this torque wrench, we must insert the part with the torque measurements. Fit it again by screwing clockwise. And for the last part, you can pull the lower portion and fit the driver adapter.
After lubricating, the torque wrench returns to normal operation, both for implant placement and for counter torque.